Good afternoon. Before getting into the program, I kindly request all the participants to mute your audio and video. Also, make sure that you do not switch to the presentation mode. Soon after the lecture, the participants can clear all your queries by posting your questions in the chat box or in the comment section of YouTube channel. The link for the feedback form will be posted in the chat box at the end of the webinar. So a very warm good afternoon to one and all. Here begins our second session of 134th Dr. John Matthai Memorial and National Webinar. So to get started, I request Prinsha KP ma'am, the Faculty of Department of Economics, to welcome the gathering.
Good afternoon, one and all. We are graced here in one of the glamorous events of the webinar to listen Professor Dr. Udaya S. Mishra, Center for Development Studies, Trivandrum, delivering the first invited lecture on some revelation of insecurities and vulnerabilities. On behalf of the Department of Economics, I wholeheartedly welcome Professor Dr. U.S. Mishra sir to the session. Also, I welcome Mrs. Priya S. to introduce Dr. U.S. Mishra sir and Ardhana M. Prabhash to deliver the vote of thanks. Last but not the least, I welcome all the participants online and offline to the wonderful session. Now let me invite Mrs. Priya S. to introduce Dr. U.S. Mishra sir. Thank you.
Good afternoon, one and all. Thank you to Dr. Sabina ma'am for giving me an opportunity to introduce our chief guest of this session. Today, we have a versatile genius and profound scholar in economics, Dr. U.S. Mishra, who is working as professor in Center for Development Studies, Trivandrum. The eminent economist who has specialized his wings on population policies, gender studies, health, human development, poverty, and inequality. He was awarded PhD in Population Studies from International Institute for Population Sciences, Mumbai. The intellect has been 29 years of teaching experience in various reputed institutions. He has professional and technical collaborations with more than 14 reputed international institutions and served as temporary scientific advisor of World Health Organization, expert group member of the United Nations Statistics Division, New York, technical advisor of University of Amsterdam, scientific advisory board member of Ford Foundation, member of International Editorial Board, member of Governing Board of CD, member of Academic Council of International Institute for Population Sciences, etc. He has more than 115 publications in reputed national, international journals and books. There are several PhD and MPhil degrees are awarded and ongoing under his supervision and guidance. Jawaharlal Nehru University, New Delhi. Absolutely, we are blessed by the valuable presence of Dr. U.S. Mishra today on this auspicious occasion. On behalf of the Department of Economics, University of Calicut, once again I welcome you, sir, to deliver the lecture. Thank you.
So,
over to you, sir.
okay. Good afternoon, friends. This is really a pleasure and a privilege for me to be part of this great initiative and a wonderful occasion for John Matthai Center and University of Calicut, who have been celebrating the birth anniversary of a great statesman like John Matthai. And I personally feel privileged to be part of it because of one reason, that I work at Center for Development Studies, and our connection with John Matthai Center and its output has been almost for the last so many decades. Students from John Matthai Center have been trained here and have been alumnus of this center as well. I consider, before I go into my lecture, I consider that this kind of a circumstance, that's a pandemic, and examining its derivatives and consequences in the society, has been an engagement for the intellectuals in our country for the last 6 to 8 months and unabated. I would say that everybody, every researcher, every social scientist is trying to look at this pandemic from different lenses and looking at the pandemic's consequences, long-term as well as short-term. I was very happy when Dr. Javina contacted me and asked for delivering a talk on the particular issue for this specific webinar that you have organized. I was wondering as to what I should speak on, but as for the during last 6-8 months working from home, I have been also writing on this issue in various forums. I thought I will gather something, consolidate something for the young audience to hear about, which is not merely a particular specific consequence of the pandemic. As thanking you all for that kind introduction that I specialize in the area of health and human development. I would be speaking that a pandemic of the last century and a pandemic of this century, every pandemic that comes our way comes as a threat, comes as a challenge, but also offers a lot of opportunities, a lot of rethinking, which needs to be done. In that perspective, what I did is that I thought appropriate to speak to you on a topic that is not generally in nature or in the mainstream as to examining macro, micro, health, development consequences of the pandemic, rather than examining what this pandemic actually revealed. This pandemic actually made many things naked. The truth, which was covered under the guise of celebrated development that we feel that we have attained or we were proud of. So to begin my lecture, just I want to give me a second to put on the screen the presentation so that are you able to see it? Hello?
Yes, sir, we can see it.
Okay, fine. So this is a lecture that I prepared to share with you. 2020 pandemic of COVID-19, revealing the insecurities and vulnerabilities of India. This pandemic, what is known about it? Actually, through the newspapers, through the enormous amount of engagement that people have with reading this pandemic, actually examining this pandemic on a concurrent manner with its evolving features. What we see is that from January 2020 to almost a year past, we are now in January 2021. The government of India actually recognized the consequence of it, which is going to be devastating, and adopted measures like lockdown, social distancing, and basic hygiene. This has been now, if you see, has been 3 mantras of how do we actually tackle COVID pandemic. Now, tackling this has not only done some kind of surprising consequences it has given rise to, but it has also been analyzed in economic terms as to what it did to production, what it did to economic activities. As you can see, I have outlined a few of that is very commonly read every day, that what it is doing, and it continues to have those impacts visible in the country. So this pandemic's consequences have been well talked of and well understood as to it has to happen, because the measures adopted, one of the significant measures, that is lockdown, has actually stalled economic activity to a reasonable extent. And that has given rise to consequences from where we have to revive ourselves. And that is the challenge in front of us today. Given this, what was overlooked, what is never known, what it actually made us realize, what it actually tells us that we knew but we never gave emphasis on. That is what is my talk about today. What was overlooked? Now look at it, that actually when celebrated growth during last 10 years and economic situations being very good fundamentals of our Indian economy, we are second by a simple pandemic, handling a pandemic, where we are second because of the fact that one aspect of our vulnerability is our informal workforce. Why so? Because a larger pop survival, having no resilience, no security, and low wage. Why I bring this point is that despite the fact that economic growth has been realized, there was no emphasis, there was no viewing with seriousness with regard to the growth of informality in the economy. In fact, there are mechanisms of bringing things, reforms being executed to make things formal, but we still continue with a 93% of the workforce is informal. Now, what does this informality threaten about? It threatens, the question is about the measures that was adopted to handle the pandemic. Is the lockdown, the social distancing, the two viable strategies, which largely in this informal society perhaps will sound very, very impractical. You will come to know through my lecture when I go through forward to talk about the same issue. In fact, it is not the poverty, it is not the poor population, it is not the marginalized communities, it is not those issues, but issues of informality. When I say, we have a workforce which is, and the entire space of informality actually accepts these things, and we feel that that is acceptable. And in this current instance, it has become very clear to us that that is unacceptable, because we need to rethink about maintaining informality where it always coexists with a large amount of insecurity. And that is what I feel to expose here during my lecture. Again, if you must have read in magazines, newspapers, there were a lot of hue and cry about migrants working home, migrants put in quarantine facilities, migrants fed from community kitchens. What does these things actually inform us? A measure which might sound very, very socially responsive. The measures that were adopted may sound that they were very much timely, they were very kind measures that were adopted by the state, but don't we realize that we had this kind of population who are vulnerable in our society, this kind of population which need these things, and that the measures that are adopted have actually led to this kind of desperate situations where human life was threatened, human beings were not treated, human beings were not having the means and ways and means to even live their life or accept the kind of measures that were suggested to deal with the pandemic. Now, misleading measures of workers' well-being and low sustainability. Why I say so? Because whenever we talk about well-being of a worker, when we talk about poverty, when we talk about deprivation, when we talk about poor people, what we talk about or what we assess really is the means that they have to live. And means of living has been always a kind of a yardstick by which we say this many people are poor and this many people are non-poor. We have to remove poverty. You must be aware that in this current environment of sustainable development goals, there is always a goal and a target fixed in terms of reducing poverty. But what makes me say this today to you is that the conceptualization of poverty, whom is said to be poor, is not enough and sufficient anymore. It is more important to say who is vulnerable. It is not important to say who is poor and how can we make the poor people come out of poverty. Poor people can come out of poverty by providing them means, but can we sustain it? And actually this viewpoint of understanding poor people or understanding marginalized people or understanding people who are vulnerable, the vulnerability is not about being poor. Vulnerability is about sustaining yourself in an adverse circumstance. The pandemic revealed that majority of workers in the informal sector do not have sustainability even for a week. That means the things that we talk about, that in our workspace, the kind of wages, this kind of security, the kind of assurance that we provide, even does not allow them to be sustaining their life for a week. Imagine that what kind of wages are we talking about? What kind of well-being are we talking about of the workers? And what kind of a situation of workspace and the work environment that we are proud of in terms of providing employment? And you know, the entire discourse on employment is giving, starting from NREGA, which assures few 150 days of work in a year. Is that sufficient? We must have to rethink that it is not deprivation, it is not poverty, it is the vulnerability that we can, one particular individual or a household can withstand in times of adversity. The lockdown was not a wished one. A lockdown was forced. It forced people to come to the streets, and government had to take care of all necessities of the informal workers given their low sustainability. That means, what I say is that we have workers who were in work, that means they were only having the means of earning, that is from work, which can sustain them for a few days, even not a week. So definitely there is a need for re-recognition of well-being of workers is much needed. What I'm trying to highlight is that this entire pandemic and the evolving situation that we actually witnessed makes us understand that we must redefine what is the real vulnerability. It is not the state of poverty. It is not the state of deprivation that we have, but it is the state of sustaining oneself in situations of adversity, which was never there. It came our way when all economic activities were overnight shut down, and people have to have their own means to survive on, and we found a majority of our population and majority of our workforce who are engaged in an informal space do not have or could not have sustained themselves for even a week's time. Now, second thing is, it is from a worker perspective. Let us talk about working conditions and employers' accountability. When a lot is spoken about wage, work, laws, employment, and many other measures which are coming our way through reforms, it is very, very important to see that in this kind of a predominant informal workspace and work environment, which is actually running our economy, it is one thing which is completely overlooked, that is employer accountability is very poor in India. During the pandemic, this came out in open. During the pandemic, workers were left to their own fate. Although an employer is supposed to, an employer is actually required to actually defend, required to protect, and actually work conditions that should make an employer engage a worker should be involving these things that you cannot under times of adversity. In times of adversity, in times of situations like this, wash of your hands. There are state-sponsored various social security programs such as accident, medical care benefit, housing program, educational allowance. We have many protection measures, but think of it that from an employer perspective, When in an informal space, an employer engages 10 employees, 8 employees, there is a loyalty relationship between an employer and an employee. But that this pandemic made it open as to how these employees were left to themselves, and no employer was accountable to the kind of such situation and circumstance the employees faced because of the pandemic's measures, like what you see as lockdown and every economic activity shut down instantly. So with wage increase and days of work, schemes by employer which protects the worker should be included while measuring the working condition. When we talk about working condition, we talk about risk, we talk about insurance, we talk about protection. We never talk about the fact that what kind of wage accountability that an employer should have, or the employee should be protected by state-sponsored schemes that they are able to get non-working days of wages. Non-working days of wages are very important given the fact that we observed that our workers could not sustain for a week's time with their surplus wages income that they have. Another thing that happened through this measure of lockdown is that it is what I term it as the measure of a middle class mindset. Work from home or no work at all, because work from home is not a generic terminology that applies for all kind of work. The unequal preventive measure of lockdown emerging from middle class mindset define work from home. People like us, people like who are white collar workers can work from home, do all kinds of work, and it is still doing is a kind of thing that is perhaps applicable to a very, very minimum share of total work arena of the Indian economy. So work from home can be the new normal for India, but it can be a new normal for a specific group, an elite class of people who can work from home. Wonderful. Working virtually or work from home is only possible for a certain category of workers, teachers, software engineers, especially white collar workers. But what happens to a fisherman? What happens to a carpenter? What happens to a person who has to put his work can only be executed in a work site. It cannot be executed from home under any circumstances. So work from home measure, which was adopted as an alternative in a situation of lockdown or social distancing, these three mantras that they have for the pandemic, that was very, very selective and very, very non-inclusive of the wider range of workforce that we have in our economy. Therefore, large section of the workforce could not adopt this alternative way, which is rather very unequal and equivalent to no work. It is not work from home. It may be work from home for us, but it is no work for others. Okay? Now, such a measure neither had an a priori assessment of protection required to design a prolonged lockdown to avert its consequences, nor did it take into its calculus the vulnerable who do not have a means of living without budging from their homes. That means this is a measure which was adopted, it was thought of, thinking the organized sector of workforce, where you have a total informal workforce, which particularly can never be, this particular intervention can never be effective for them. The assumption that certain degree of resilience for survival to be universal across the country didn't consider the vulnerable, didn't consider those who are migrant workers, didn't consider daily wage earners, didn't consider domestic servants, didn't consider providers, service providers like ranging from conveyance to eateries to domestic work. That means this entire economic activity, which is having such a significant share of it in these components, did not perhaps make any consideration. They were never considered in the calculus of providing how will they be resilient, how will they be protected, under what kind of condition do the state provide things for them, was really overlooked, and actually the consequences are visible now as to what happened to them. In fact, This is where this pandemic revealed the reality that we have a kind of vulnerability that needs to be recognized, that needs to be rethought of, that needs to be revisited in our policy making when it comes to protection, when it comes to security. Working on site with protection such as wearing a mask and sanitation would have been possible alternative measure in contrast to working from home. Working from home has been a selected measure for the elites who want to keep themselves away, who want to keep themselves safe from the vulnerability that is otherwise in the open air. You work from home, you protect yourself, you actually seal yourself. The shielding the elite from the risk of this infection has been very successful for the fact that this working from home measure has actually contributed towards. Okay. Now I come to the second issue of revealing reality. The revealing reality is that at one point of time, it was never discouraged, it was never thought of that human beings live in an inhuman manner. Actually, the growing urbanization, migration from rural to urban, shift from agriculture to manufacturing sector are widely celebrated a measure of development. But the fact that in the process, human living was compromised was overlooked. These all measures which are actually considered indicators of development, growing urbanization. There is a significant share and flow of people from rural to urban areas. Work in manufacturing sector, the shift of workforce from agriculture to manufacturing. These are parameters of development. Nothing to say no to it, but if they are, in the process, we are actually overlooking the fact that human living is compromised, and that got realized in this pandemic situation as to how it actually had a consequence on. This pandemic surfaced that unequal and unjust human living in urban space. When urban space is typical features of greater density and differential access to basic amenities, with growing urbanization and competition for existence, basic living conditions have been the first casualty, and it is compromised beyond imagination. It was never thought of that five people live in one room. People share basic sanitation facilities to a level that even it is inhuman, it is also very much prone to the kind of risks that can happen because of unsafe sanitation and availability of basic services for living. Access to safe drinking water, proper sanitation and health conditions to protect from the infection is necessary to stop human-to-human transmission. Therefore, the very example of Mumbai slums came into prominence because the infection spread like air. It spread so quickly that it was later thought of, even the international organizations thought of, that the multiplier that it has otherwise about the infection in terms of the spreading parameter or the multiplier, that also broke the record because the kind of existence of human beings in the slums in terms of vicinity and closeness, the transmission could never be stopped. So we had a situation which was already vulnerable, referring to the living condition of urban millions. This is something, a basic data that I had put just to see that actually in the growth rate of the cases, it is a dated figure because this was something which was published by me in the magazine Down to Earth, and that I could see that why the active cases were higher in Maharashtra, because I was trying to compare most of the states where actually this is very high. It is not merely the degree of urbanization of that state, but also the existence of slums in those states. And that made a big contribution in terms of the active cases increasing. Now, findings from NFHS 4, which is also a large-scale all-India survey, they do give evidence that 56.94% used unimproved toilets in the slum households, and 63.76% live in one-room tenements, and then 76.25% have limited access to water for hand wash. So these are the three things which are very important measure to protect yourself from COVID infections. And this COVID infection protection, therefore, is out of the window when it comes to the slum living. And the slum living population is purely vulnerable because they can never abide by these measures, even if they wish to. World Economic Forum, for example, said that Dharavi has a high population density of 270,000 people living per square kilometer. So imagine if this kind of urban growth and this kind of urban living we encourage, then we will have to face the consequences of this such pandemic if that comes our way. Tomorrow another one, then we may not have any means to control its spread. This undoubtedly makes social distancing norms impractical. We talk about advertisements, do gaj ki duri. Do gaj ki duri will be possible in a place where there is a space, there is a discrete space in terms of there is an available space for living. For instance, there has been suggestion about if you get a COVID infection, you should quarantine yourself. Where do people quarantine? For quarantining, you need a room, you need the basic facilities. Keep this quarantine materializing, this whole phenomenon of quarantine requires service which is very, very different. Most of the families who live in single rooms depend on community toilets and water taps. They cannot conform to these quarantine conditions that is written down as norms. Underserved and underprivileged residents with the limitation of housing and basic amenities fail to adhere to the required prevention protocol. The most vulnerable are slum residents and those with compromised living conditions. Therefore, the living conditions of Indian households came into audit. The living condition of Indian households, when they were audited, it was later discovered that actually, in true sense of the term, we have Indian households, apart from the rural areas where the spread of the infection didn't go with that intensity, in urban areas, the conditions of living were very, very compromised and were never in keeping with any ideal norm that can prevent the spread of the infection. This is where actually we did a kind of an analysis of COVID-19 infections and the cities with certain amount of slum population, and the slum population, COVID-19 influenza correlation with slum share of population that was in the that is available, and the kind of infection magnitude figures that we obtained, we found a strict pattern of positiveness, because once you have COVID-19 infection higher, it is not in Mumbai, you see, it is in Indore that actually that means even slum population which are much more disadvantaged, much more deprived of basic amenities than even in the well-recognized cities like Mumbai and Delhi. Therefore, this exposition conforms and reaffirms the argument that I make. Social distancing is a possibility for those who have the luxury of living with minimum basic needs like water and hygiene, which is perhaps the least priority of those urban dwellers who compromise on all of this by using public facilities, share a common living space meant for one among four. So that is, 4 people use a space which is actually meant for one. Unsurprisingly, the number of cases were reported mostly in densely populated and highly urbanized areas. The reproductive ratio of the virus is 20% higher in India's slums because of dense living conditions. That means this is not to say that we should urban space is always densely populated. Density of population does not mean that we actually compromise and live like in an inhuman manner. Human beings can live with closer vicinity, but human beings can live with proper dignity and with basic amenities at their disposal. The pandemic is an eye-opener for the compromised human living. This is what I'm focusing on, that rather than making human development index and being proud of which rank do we attain in the ranks of the countries or across the states, it is basically making an index of compromised human living. Compromised human living index perhaps will be an alternative to say that how are human beings living in certain regions of this country, certain pockets of the urban belt where it needs to be intervened, and interventions should be quick to say that that intervention will make them live in a humanly manner. This is why compromised human living has to be focused more than just merely indicators at aggregate level as to how many years of life we have, what education we have attained, and how much income we have. This aspect of human development has to widen towards actually considering human living as a priority rather than the outcomes that we have attained through one or the other means. The current crisis should send alarm bells ringing for governments and urban planners in the country over sustainability of our cities and for its citizens, because this kind of pandemic can actually wipe up population very quickly once it is not intervened. And this is not merely an infection about which a challenge came to us that we attended. We are also of late hearing that we have got to manufacture a vaccine for it. We can have an infection, we can have a vaccine, but that does not take away from the fact that this definitely indicated to us, opened our eyes to the fact that we are not giving focus, we are not emphasizing on the very necessary and ground level requirement of human living in urban space with minimum compromise of health and hygiene. Ensuring good and consistently applied water sanitation and hygiene and waste management practices in communities is a prerequisite for containing the spread of the epidemic. This epidemic has a larger share. The risk actually lies in the vulnerable regions that we have, and we have actually neglected it over a long period of time. In case of such an outbreak, the associated measure for its containment, basic deficiencies of the urban poor are overlooked, not just in terms of compromised living, but also limited access to medical care, because an urban space has a lot of migrants. And you know very well that actually the kind of claim that we make in terms of access of health facilities in urban areas may not be an universal access. It may be restricting access to a majority of the people who are migrants in urban areas. So one of the alternative ways of thinking is to think how will migrants be actually entitled for the basic medical care and health facilities in an urban space, who might be sometimes temporary. Most importantly, urban planners need to urgently rethink about sustainability of mega cities in the wake of this outbreak. Now I come to another focus, which is very important, and very important in the sense that we all have faced it. Every parent who has small children going to school have actually experienced it. Long-term cost on the education sector. Because of this pandemic and the lockdown, it is almost an year of spoiler for the complete educational curriculum. We have found alternative means of execution, but we do not know till now so far how effective has been the alternative scheme of implementation. Education sector will suffer a major setback. We may experience a rise globally. It has been agreed that we may experience a rise in the dropout rate due to economic losses and vulnerability. Prolonged school closures along with economic and health strains brought on by the pandemic may cause many children to drop out of education system permanently. The students may face increased pressure to drop out of school and earn for the family, especially in times of economic distress. So it's not only current academic year loss, but long-term educational loss, since the dropped out students will be in the job market without proper education and increasing unemployment rate being a reality. Question is, this particular implication of this pandemic on education sector has not yet been evaluated in its whole, because situation is still evolving. We are still in the process of opening up schools or not opening up schools or adopting alternative means of executions of teaching through digital means. However, this particular means has to be tested and verified as to whether it is doing an effective replacement to the real offline, real school education being face-to-face and not in a virtual manner. So this particular exercise and intervention which has been brought in perhaps is not a permanent solution. It might be giving a solution in times of setback like this, but what makes it more important that I highlight the education sector is that education sector in our country, or the schools in our country, need not be looked at only as institutions providing education. It has multiple contribution of other activities. Its engagement in terms of ensuring nutrition of children. Its engagement in terms of continuing 7 to 8 hours of children being away from home, children being arrested at home. The kind of occupation of engagement of children at home perhaps poses a great challenge to the parents, more importantly, rather than talking about what the education sector can adopt if in case of a pandemic like this, it continues and it evolves in different forms in due course of time. This is a statistic which is borrowed from a particular paper in a worldwide study on percentage of children unlikely to return to school post-pandemic. Look at, in India, they're saying more girls will be dropped out of school than boys. And in fact, across all countries, they have done a study in full sample, it is less girls than boys, but in India, they have assessed that number of girl dropouts from the school could be much higher and compared to boys, and there will be an extent of dropout which is ought to happen because of the post-pandemic situation. Percent of children reporting that they are unlikely to return to school by gradation of the standards. If you look at it, actually as you go standard higher, the dropout rates might increase. That means consequential educational profile that we will have a consequence of the pandemic revealed when we analyze the educational performance data a year or two from now. So this indicates the situation of school educational consequences of the pandemic. Fear of COVID, school fees, and the need to work are key reasons for dropouts. There's a study which I showed you the few pictures and the graphs, major findings of that. Children from households experiencing a cash crunch are at higher risk of not returning to school. That means they will get into workforce. A significant proportion of children are not engaging in any type of learning activity at all, especially children from households with financial difficulties. So we can very well see that the kind of intervention we are thinking of as an alternative to keep these children engaged with education, it's perhaps a misnomer, because it is our assumption that digital access to education is an universal truth, but actually the statistics and the data from other sources do indicate to us that what kind of digital divide exists in this country. Girls are likely to spend more time doing chores and caring for the siblings, which takes away from time spent on schoolwork. Understanding and addressing these financial and health-related concerns is crucial to make sure children do not drop out of education system permanently. That means a job at hand for us awaits to assess that whether the consequences that the COVID has led to is going to be a kind of a situation, its consequences on schooling, its consequences on educational outcome, its consequences on what the schooling infrastructure did beyond education. For instance, there's a lot of discussion in relation to the nutritional fallout of the COVID consequences, because the nutritional interventions were largely done in schooling environment through the noon meal schemes. There is a long-term cost on health due to prolonged closure of schools. There is a health consequences linked because of the children being restricted to home. Education sector and health sector are strongly weaved into each other, having high intra-sector linkages. Nutrition targeting is done through educational institutes. Major nutrition supplementation program in India are mostly school-based. ICDS, midday meal program, and other things are all linked to education. Even at Anganwadis, the preschool education is emphasized. Therefore, I say that education cannot be seen away, it is merely the health consequence. Children belonging to backward classes, scheduled class and scheduled tribe families are given priority in these schemes. Therefore, the marginalized will get further marginalized, further deprived, and become more vulnerable. The prolonged closure will pose a risk to the nutritional status of children from these marginalized families. This is first thing first, and then finally I come to the fact that we have been proud of, we have been listening that we have COVID warriors, we have actually, and we have reached a situation now that we say complacent, but actually we are accepting the fact that we have owned partially the war on COVID. However, the indicators that needs discussion now is the most highlighted indicators of health sector is the human resource for health. It is outcome, access, and cost, but the pandemic revealed one of the major limitations, that is human resource for health. Our human resource for health is definitely not keeping with the norm of the WHO is well known. It is compromised because the health workforce is far below the population target that the WHO suggests. Skilled health workers in India does not meet the minimum threshold of 22 skilled workers per 10,000 population recommended by WHO. This is appeared in Asian Scientist 2019. And an examination of this shortfall do indicate to us, also awaken us to say that we must qualify this required norm if at all we feel that we have the required health workforce to take on challenges of this kind in future. Considering doctors, including even Ayush and nurses and midwives, the density of health workers is 20.6 for 10,000 population, 2.2 short of the required norm. According to the NSSO estimates, this is a paper which is there in British Medical Journal written by Anup Karan et al. So this assessment has been done to just to match the figure or to become close to the figure, because we have taken everyone, nurses, midwives, Ayush doctors, everybody. If we take everybody and analyze, still we fall short of the required norm prescribed by World Health Organization. This is the number and percentage distribution per 1,000 population and other support workforce in the health sector. For the benefit of the young participants in this seminar, I actually want them to look at that basically type of workers and the total number of support workers in the health sector. The type of workers when you see even motor drivers there. That constitutes in the distribution certain percentage, but they work in the health sector. So health sector and health workforce needs to be distinguished. Therefore, one of the very alarming thing which I must notify to this audience is that we have till now no proper assessment or engagement with the kind of disparity and disproportionateness of health workforce across our country, across the rural and urban areas, because of the fact that actually there are regions in our country that we have certain number of suppose specialists like cardiologists. But if you go in this country to a place where actually one cardiologist caters to something like 30 lakh population sometime. Because I belong to a district in Odisha, which is a very well-known district called Sambalpur, which in its vicinity does not have a qualified cardiologist or a cardiac specialist for catering to almost 20 lakh population. Therefore, this is something which needs focus. This is something which needs attention in the sense of not merely qualifying the HRH requirement, but its disproportionate distribution and unequalness across the regions, length and breadth of this country. India having a shortage of healthcare workers has severely affected country's COVID-19 response. To plug the gap, various local and state governments had launched recruitment drives, but with little success. For instance, Bihar, despite having advertised for 9,000 posts for nurses, it was only able to fill around 5,000. That means imagine that there are regions when there is a requirement, they are not able to even get those professionals in those regions. And this is the reason why I emphasized and I highlighted that this particular concern about the distribution of health workforce around our country is a very, very important engagement which is required, and it is urgent. Health sector didn't have necessary infrastructure for the large population. Thus, during the pandemic, the government has to engage local administration to accommodate the execution of intervention at the local level. Even at global level, countries were facing difficulties at meeting these health demands that emerged because of the COVID pandemic. The local administration was roped in to conduct awareness programs, set up community kitchens, quarantine centers, interstate migrant shelter, providing food and health care. Therefore, this is very much a kind of an exposition that we know that our health workforce, our total health infrastructure, it need not be in terms of indicators like beds per thousand population, doctors per thousand population, and not overlooking its distribution, its disproportionateness, as well as its concentration in urban areas and not all over the country. Because a pandemic, when it strikes, it requires and it actually re-evaluates the position. It is an opportunity for us to re-evaluate and relook at the concern that is at hand. So ultimately, having said to you education sector, health sector, economic sector vulnerabilities and all, I wanted to actually summarize that what has led to such a situation. In fact, there has been discourse which is going on, which is very important to pay heed to. For instance, unequal exploitation of nature, I say. Pandemic served as a balancer of economic growth and sustainability. When you have economic growth, and when people talk about sustainable growth, people actually think about environment, people think about exploitation of nature, natural resources, renewable natural resources. However, it is more important to understand which economic growth is ideal, what magnitude of growth is ideal. It is not a race for growth, but it is also a race for sustainability. The unifocal emphasis on growth and GDP now is shifted to degrowth. Grow slow, but grow equally. Have a growth rate which is ideal, but look at its distribution. Pandemic has actually restored the sustainability of Earth. For instance, restricted movements, significant slowdown of social economic activity has improved the air quality, has shown that actually ice cover has re-emerged in the North Pole with a reduction in water pollution in different parts of the world. And this itself indicates that perhaps pandemic was a natural intervention that came our way to make us compelled to realize that our ways of nature's exploitation has crossed limits. There is no doubt about it, and actually a concern regarding that is very important. Studies have found significant association between contingency measures and improvement in air quality, clean beaches, and environmental noise reduction. These studies are actually purely empirical studies, and these studies are evidence to the fact that these measures, when actually maybe forced upon, but these measures do show the consequences that is perhaps possible if we restrain ourselves in terms of overexploitation of nature. A reduction in atmospheric pollutants emitted by factories, ships, and other sources masked global warming intensity and made the Arctic cloudier and colder. In the Nature Climate Change Study, an international team of scientists found that daily CO2 emissions dropped by 17% at the peak of the coronavirus shutdown. That means a mechanism that has come our way through force, come our way without our will, but soldiers adopted, involve lockdown, social distancing, and adoption of proper hygiene practices for its prevention. While there is no denying the fact that these measures are consequential upon arresting its spread, how far are they suitable for the Indian population? This is a question mark. These measures are worldwide recognized, but is our population ready to adopt these measures in equal proportion? An assessment of desperate measures adopted to contain this unexpected enemy makes an exposition of our vulnerability in modern living and hidden interdependence between class of people. The emergence of COVID-19 brings home another message of greater relevance that echoes against the ever-rising inequality which cannot be sustained without it presenting a threat to human race. This is itself a kind of an exposition which I wanted to make, that we can overlook certain disparities and inequality till a certain level, beyond which this kind of emergence will make us sensible and make us awake to the reality that something unjust is happening. Okay? So the COVID-19 pandemic has exposed numerous limitations of human living, along with related vulnerabilities. A large share of our population contesting the celebration of reduced poverty, improved living condition in recent times. That which we are celebrating are perhaps false celebrations. Lessons learned may well define the ideal and bridge the gap in means between us and them that defines the social order of today. Why I say so is because it's not mere inequality in consumption, inequality in income, but we have to have a threshold of basics. That is why I write this very strongly and convincingly, that lessons learned may well define the ideal and bridge the gap in means between us and them that defines the social order of today. It is not that difference that anymore needs to be sustained as us and them. This episode is an eye-opener to reveal that if we are to recover from the crisis in future, we need to strengthen and equip the basic health and public health infrastructure of India to cater to all its citizens to guarantee sustainable living. Because the human resource for health, in fact, despite the repeated, resounding emphasis on the percentage allocated of share of GDP to health sector, is not perhaps a solution by itself. What is the solution is really the human resource for health. Human resource for health has to be emphasized, has to be examined, has to be monitored, and its distribution has to be carefully seen as to there is no discrepancy in terms of access to health care because of deficiency of human resource for health. The focus should be more on distribution rather than growth, so that everybody can have everything. The pandemic has revealed the vulnerabilities and the insecurities of India, which need immediate attention for sustainable living. Okay? With these words, I actually thank you very much for this opportunity, and I look forward to your reactions and response. Thank you very much.
Thank you, sir. Thank you so much. This session was a really informative one. You have clearly pointed out the evidence and data to explain the vulnerabilities and insecurities of all the sections of society, of all sections of society who have been went through this phase past 10 months. So, and thank you, sir. It was really a fruitful session. Now it's time for an open discussion. So I request all the participants to post your queries in the comment section so that we can have a discussion here.
Sir, very good informative session. I am very much
Yes, sir.
impressed upon uh, your statements. Okay, but
Right.
I have two doubts.
Yes.
Shall I ask? Shall I ask?
Please go ahead, sir. Please.
Yes, yes. Uh, Throughout the narration, sir discussed during pandemic pandemic, workers were left to their own fate, their own fate.
Mm.
But I think the circumstances warranted them to confront with the circumstantial created fate, not their
Okay.
own fate.
Mhm.
It is the fate that created circumstances, not the
Right.
fate that selected or chosen.
Yes.
And another one, the prolonged closure will pose a risk
Mm.
to the nutritional status of poor.
Yes.
But I think it is a paradoxical statement because on
Mm.
the ground that the poor are struggling even for their bare necessities of life,
Mhm.
then how can we say it will be a,
Mm.
it is a, uh, how can we say uh, the uh, nutritious food, how can we give much
Mm.
importance to the nutritional
Nutrition.
food because nutritional food
Mm.
because they are struggling for their necessities. In that case,
Sure.
in that circumstances, how can we say the nutritional
Mm.
food or importance to nutritional food? And the focus should
Yeah.
be another one. The focus should be more on distribution rather
Mm.
than growth. I
Mm.
think my question is, without
Mm.
growth, how
Mm.
distribution is possible? That is the question.
Mm.
Okay, sir. Thank
Yes.
you. Okay.
Thank you.
Okay, sir.
Okay. Should I take few more questions or I should respond? May I? Hello.
You may respond, sir.
Okay. Okay. Thank you very much, Mr. Ramachandran, for your query. And I think I do appreciate the questions that you have raised. But if I'm a wish to reply or to give you some kind of a reply to what concern you have raised, one is that what I am actually hinting at is we must redefine poverty. We must not define poverty in terms of basic compromise on basic needs alone. What actually I am hinting towards is that this redefinition of poverty should include the aspect of resilience, because the aspect of resilience is so important. If you are saying that 20% people are poor, and around the threshold of poverty line, you have another 30% people who can become poor for a simple shock that if they don't get 2 days of work. What does it mean? That means we are cheating ourselves. We are making a kind of an assessment of poverty, which is not a sustainable one and which does not take into account resilience at all. The second idea that you talked about is about nutrition. I'm not talking about nutrition. I'm talking about the fact that human living or mere consumption need not be looked forward to from state resources. If I think that I am well off, or if I think that I am having work, I'm an employed person, I'm having wages, do you think that at 7 days of work stopped, I become dependent on the state? That does not make me, that doesn't sound like that we are actually protecting or we are having an accountability within our ideal wage structure as to what kind of earning is necessary, basic earning is necessary to protect oneself. And the last but not the least, you rightly told, it is distribution which is important, but growth is essential. But complete unabated emphasis on growth, and growth with many compromises, growth with lopsidedness, growth with unemployment, growth with many other adversities are perhaps not necessary, or this kind of going behind growth like indiscriminate, unattended to anything else, may well be resulting in situations that is irreparable. Therefore, I think if we compromise, I'm not saying arrest, I'm not saying degrowth in real terms, but what I'm saying is an ideal growth is necessary, but not a growth that completely overlooks distribution. On that point, I fully agree. Thank you very much, sir, for raising this concern. Thank you.
Thank you. So We have two more questions in the comment section. Can I read
Okay.
it out?
Please, please.
Okay. The first question is asked by Manju P. Sanil. She has asked, since employers also affected by the lockdown, how we can blame them for not being accountable? And the second question is asked by Regula Helen ma'am. The question is, please mention what kind of the growth strategy is needed to strengthen environmental sustainability.
Yeah, yeah. See, the first question is, I raised that issue because of the fact that when we talk about employment, we have a lot written about the workers' right, working condition, wage regulation, and many things else. These are all towards protection of the employee. Fine. But that is always from the state perspective. But what happens is that given the large informal workspace, the employers who actually engage workers and employers who give wages to workers, they have to have a kind of a mechanism to be responsible in times of emergency. It is not merely protection that somebody fell down, you give insurance. Suppose the days of work stopped. For instance, a flood comes, your entire thing gets stuck. Then you cannot just say that your employees should fend for themselves. That is what I feel is that employer's responsibility. It is employer when we think of in our mindset of whatever you may say, our developing country, democratic mindset, we always have state as the big boss. But state actually should implement this protection mechanism through employers. And even if it is informal, it is employers who should have certain responsibility or ways and means to protect their employees, which should be in the system. If it is not there, then perhaps this kind of a situation will emerge. The question about how do you think of growth strategy that is with environmental sustainability? I would say that it is when we talk about this whole idea, of course, I'm not a very expert or a big expert on sustainability by myself, but I will give a very simpler definition of sustainability. Sustainability is understood that there are certain adversities happening or not. No, not necessarily. In fact, sustainability is to be a kind of a component where actually blind race behind efficiency should not be there. Sustainability is about increasing welfare within the same means. Are we able to do that? And if we are able to do that, there has to be parameters and mechanisms. But if you talk about growth strategy with environmental sustainability, then it is nothing but emphasizing on what is called the renewable features. The renewable features are more important, and renewable features of anything which can be renewed. For instance, I'm talking of renewal, not don't think in terms of like, for instance, whether with the energy sector or something like that. For instance, nobody thinks about renewability when, because I'm a demographer, I must say a population's age structure changes, but its workforce structure doesn't change. That means what? You have to retire at 58. You have to retire at 55. Your wage structure can keep on changing. Age structure keep on changing means the workforce structure has to change. People have to go remain in the workforce for a certain period. The justice is about duration. So basically, my answer to your question, though I may not say that it is actually a very convincing answer, but it is the renewable feature that should be the emphasis. Thank you very much.
Thank you, sir. So we have one more question. Can I read it out?
Please.
Okay. The question is asked by Manikandan. The question is, what is your opinion about the proposed one nation, one ration card system as a combating measure on ensuring food security to the vulnerable sections of the society, especially migrants?
You see, these kind of remarks, this may sound like very good, what is called slogans, but I must say that the whole revolution which has been brought about in terms of identity with the Aadhaar system, it has never served its whole purpose as yet, because it has never recognized across systems. When across systems it is recognized, while there is a freedom of mobility, which we say that in a country, I can go across state boundaries to any place by my own will. But this itself does not ensure me all possible rights that is required for my comfort or life. For instance, a person moves into a city, and we are a country with diversity of languages, diversity of systems, diversity of many things, provisionings which are so much local in nature. Therefore, when somebody wants to access any service of that kind, has a lot of inherent difficulties. Therefore, when one says that one ration card, one nation will solve the purpose of food security, what needs to be done is that it is not always through the system, but this recognition of entitlement should go beyond the system. For instance, if I have a card in which I can obtain the similar subsidized allocation of food grains from any open market, and which could not be mishandled or other things, then anywhere I go, my card entitles me, not through the system alone, because systems themselves are locally responsive. Systems themselves are very much local in nature, and that will restrict me to get my entitlements. You are right that actually, if you look at it, to obtain a kind of a license, for instance, I'm giving an example, that I migrate to Bombay city, I want to be a driver, I want to obtain a driving license. Now for the driving license filling of form, I have to give a lot of proof of identity. And this proof of identity, what proof of identity will I give so that I want to obtain a license in Mumbai city? Now there is a racket which actually works. So this, all things can be avoided provided there has to be a kind of a way out to obtain or fetch your entitlements beyond the system. If it can be done, there is nothing like that, but I do not think that is the vision of the state. But at least there should be a mechanism of transfer. For instance, you look at it, if you have a bank account in your native place, do you get any difficulty in operating a bank transaction if you moved out of the place? No. So if you have something in hand which is having some kind of a stamp of nativity or some kind of a recognition or indication that you belong to such and such place, why should it come as a hindrance in terms of getting your entitlements elsewhere? I fully agree with you that actually one nation, one ration card is necessary, and that should be a ration card for the individual. It is not with other identities that is very important, and that should not come in the way. Thank you.
Sir, we have two more questions. Can I take your time?
Please.
Okay. Again, we have a question from Manju P. Sanil. She has asked, please explain worker sustainability for a week, how it's measured. Is it possible to incorporate this as a measure of worker well-being? And the second question is by Anjana TR. Sir, will you please shed light on the impact of pandemic on the vulnerable group like PWDs and their limited available employment options?
Okay. Now, the issue of worker sustainability week, which I was talking about. Actually, what happens is that we often, this is something to do with fixation of wages. And fixation of wages are always having a greater emphasis in terms of the kind of parity that you bring between sectors. And this parity, which is very important, is very important. And that should not come in the way. Thank you.
Sir, we have two more questions. Can I take your time?
Please. Please.
Okay.
the kind of parity that you bring across skill groups. That is what the wages is about. But what I am trying to highlight is basically the wages should account for the kind of surpluses that it can have, the kind of surpluses or forcible surplus that should be accounted for in a particular wage allocation or a wage fixation. Why I say so is because I'm reminded of an example in my young days, one of my senior telling me that you are suppose working in a job in a particular place and you are getting a wage, monthly wage of 20,000 rupees. Suddenly you get an offer to go to another place where your wage will be 25,000 rupees. Definitely, visibly, there is a rise in wage. Then your choice should be that you should accept that because you are getting a better wage. But it is not better wage that makes your decision ideal. It is basically a better saving potential that should be calculated. If in 20,000 rupees wage in a place that you are, your consumption and other things gives rise to a saving of 5,000 bucks, and you get 25,000 salary, where actually your saving potential will come down to 3,000 rupees. So basically, these two comparison of numeric wages that you talk about is not important, rather than having the surplus that keeps your resilience on is important when we talk about wage fixation or ideal wages that should be contained in the labor market. And that was what I was indicating at. And the second question was sorry, in the process I think I forgot. Can you repeat it, please? I think, hello.
Yes, sir, I'll repeat the question. The question is, please shed light on the impact of pandemic on the vulnerable group like PWDs,
correct.
limited available employment options.
Yes. You see, amidst the pandemic, actually it has affected everybody, and definitely there is no doubt about that. It affects the most vulnerable or the kind of separate groups like which are PWD or something in a more severe manner. However, I would say that the opportunities when it comes to the pandemic has in a manner not affected those, if I compare like that, with people with disabilities and all, because these are group or class of people who have already have a certain ways and protected means of employment that they have to get. They cannot go for all kinds of employment. So the question is the employment loss which has happened and the alternatives that people have gone into are quite different. For instance, a person who was working as a mason has started opening a roadside shop to sell vegetables. Now, these alternative means that he's able to do because he has none of these compromises. Therefore, definitely they are more vulnerable, they have a greater risk, but I would say the people in terms of potential expecting an employment is perhaps more worse. But those who were in employment and the conditions in which they were working, for them it could be fine because of the fact that they have a very restrictive kind of a situation where they may not be impacted that badly. And in fact, that protected environment should give priority to these group of people than others. So your question is very pertinent from one perspective, that if you feel that what are the kind of employment compromise that has happened to the existing one and potentially expecting one. These are two different situations. Potentially expecting one is perhaps more severe for those who are in this vulnerable category. But the existing ones, the openness that the alternatives will be always, somehow or other, this protective mechanism will be serving as a cushion to those who are already in, but due to the pandemic, they cannot have any alteration, so their protection needs to be ensured. Okay, thank you.
Thank you so much, sir, for spending your valuable time with us. And thank you, participants, for making this session a real fruitful one. We have got a lot of questions, and I think all of your queries are cleared. Now it's time to wind up this session. So I kindly invite Ms. Artana M. Prabhash, Faculty of Department of Economics, to deliver the vote of thanks.
Respected Head of the Department, Dr. Zabina ma'am, and our key speaker, Professor Dr. Uday Mr. Sir, and teaching and non-teaching staff, research scholars, and my dear students. Good evening, one and all. First of all, on this occasion, I would like to thank Dr. Zabina Hamid, the head of the department, to give an opportunity to deliver the vote of thanks. And also, I would like to congratulate Professor Dr. Mr. Sir, the Senior Professor, Center for Development Studies, Trivandrum, for his wonderful lecture on the topic revealing the insecurities and vulnerabilities in Indian economy. So, the talk exposed to the realities of human life, the vulnerabilities on at work on the basis of their wages, income, especially in the case of an employment or an unemployment. Actually, the pandemic revealed that the bubble of the development has broken and revealed that it is not grounded properly. So you have provoked our thoughts and our ideas. Once again, on behalf of our department, all the dignitaries, all who gathered here, I express my sincere gratitude towards Professor Dr. Uday Mr. Sir. Thank you, sir. Thank you for your thought-provoking words. I would like to thank Ms. Punsha KP for delivering the welcome speech. And also, I would like to thank Priya S., the faculty member of our department, for introducing our resource person to the audience. Thank you, Miss. Once again, I would thank all the students and research scholars of our department for their support and their valuable presence. Once again, thank you all.
Mr. Sir,
Yes.
thank you, sir. Thank you for being with us. We
Yes,
had a
yes.
good deliberation, a really wonderful talk for us. Thank you so much, sir, for joining us.
Okay, it's my pleasure. Thank you very much.
Oh, thank you, sir. Thank you, sir. Hope to meet you in other programs also, which will be coming in due course.
Okay.
Thank you, sir.
Thank you very much. It's my pleasure.
Thank you, sir. I also thank our friend Daisy, who is doing live streaming from Irinjalakuda St. Joseph's College, and my beloved friends Neha Gobi Krishnan from Mumbai College. Thank you all. Thank you all participants, my dear colleagues and friends. Thank you all. Let's join. And I'm also extremely happy that we have our Anwar sir with us to render all the technical help in this unprecedented situation of doing things. So I'm extremely thank Anwar sir for being with us, and also our research scholars who are at Vimala College helping us to address the situation in case any difficulty emerges. Anju and Ms. Kavya, I thank them also. Thank you all. Bye. Let's meet tomorrow. Thank you all.